A very good morning everyone. So today I will be presenting my seminar on the topic Craniofacial Reconstruction and Forensic Facial Approximation using the dental tools which is found in fossils. To start with, every face tells a story, even from those from the past. So craniofacial reconstruction and forensic facial approximation, it transforms the skeletal remains into a visual identity. So this seminar will explore on how the dental clues that refine facial reconstruction and it anchors forensic identity and brings ancient and unidentified individuals to life. So the evolution and foundations of craniofacial reconstruction. So it has some ancient and historical foundations. So to begin with the prehistoric times, the Neanderthal and early Homo sapiens, they have interpreted the skulls in burial context. They are decorated and reshaped during the postmortem. The examples it include jellyfish skulls that plastered faces over skulls, which will be seen later as spiritual or commemorative approaches. Secondly, we have the classical era, which is observed in the Egypt, Greece and Rome. So these are early anatomical observations which are recorded by Galen and Herophilus, which lays groundwork for understanding the facial structures. So mummification practices reveals early interest in facial preservation. So moving on to the people who have pioneered in this field, we first have William Place. In 1895, he used cranial features to reconstruct the face of the composer Johann Sebastian Bach, and he is the first person to suggest that soft tissue depth and it markers the overkey for anatomical points. And in 1895, he published a paper on the human head, which was a landmark in the development of facial reconstruction. So he did not invent the technique himself, but he proposed it, so it was done later. So this was the reconstruction which was done using the skull which was there. Next we have the pioneering the science in the 19th to 20th century. We had someone called Mikhail Gerasimov from USSR, Russia. So he developed a method which integrated technology, anthropology, forensic science and sculpture. So he reconstructed over 200 faces, including the Ivan and terrible in the Middle East region. And there was rise of forensic applications also. So that was mainly seen after the post-World War II development. So it emphasized on identifying the war casualties and disaster victims. So the craniofacial reconstruction, it gained traction during this time, and it was used as an investigative tool for law enforcement. And the studies were also done using the tissue thickness. And based on the cadaver measurements, later it was defined using ultrasound, CT and MRI across various ethnic groups, and it led to the standardization of various tables using age, sex, ancestry and body mass. Moving on to the transition of technology, that is digital era. So nowadays we have 2D manual reconstruction where artists sketch tissue layers over the cranial photograph. So they use it in forensic cases. And next we have 3D clay modeling. It uses the replica of skulls and rubber markers. So it allows physical modeling for a museum to display and to train people. And we also have some 3D digital software like Reface, FaceSafe and Forensic Artistute. It allows us to non-invasively do reconstructions. So we also have AI-based CFR, which can suggest multiple facial outcomes based on the probabilistic modeling. Next, this can be integrated with dental odontology, having this as a dental anchor. So this dentition, it provides us anatomical landmarks for determining the lip contour, the mouth height and the facial symmetry, which is a major tool to determine the facial aspects, and vertical dimensions of occlusion can also be determined. So dental wear, trauma and asymmetry, it can give clues to age estimation, lifestyle like the smoking or cultural filling which is seen in the teeth, and malocclusion related facial disharmony. And the absence of teeth, it can give emphasize about the lip collapse, the retracted profile, or the compensatory bone remodeling which is seen in ancient skulls. Alterated low face proportions, especially in elderly skulls, can be identified. There's a conceptual impact which is also noted. So CFR is being used to reconstruct the saints, pharaohs, and kings. Also the mummified species which is found in Egypt. It promotes awareness of marginalized groups in museums, and it can help us to reconnect descendants with lost ancestors. So it is popularized in media through so many public shows like Bones and Cold Case Files, also public history. Moving on to the dental contributions to facial reconstruction. The role of dentition in morphological anchoring, it establishes anterior facial height from nasion to menton through occlusion. It guides reconstruction of lip fullness and curvature based on the incisor position. It provides anatomical data for the mid-face width and smile line. The indicators from dental wear and pathology, it can indicate the accretion patterns which reflects the diet and age of ancient population. So flatter wear which is seen in older individuals. Malocclusion, as we all know, it affects the facial symmetry. Dental anomalies like supernumerary teeth and diastema, it subtly affects the reconstructed profile. And tooth loss changes, it changes the lip support in soft tissue which sags the reconstructions. There are population specific norms too. Dental arch, it forms may vary throughout the ethnic population. So we have U-shaped versus parabolic arches. Incisor approximation, it affects the mouth protrusion in certain ancestral groups. Population databases which are seen in Brazilian, African American and Asian averages help in ancestry appropriate approximations. So it's also used to estimate the age, sex and diet of previous population. So moving on to the case examples and landmark reconstruction. So there are some archaeological cases. So this is the Jericho skull which is seen in the Neolithic era. So this is a plaster-filled cranium with shell inlays and very faint facial modeling. So it is considered to be the earliest form of intentional facial approximation. So this is done as a commemoration to given to the ancestors. Secondly, we have this widow man which was found in UK during the 1st century CE. This was actually found in the 19th century, and using this remains the facial reconstruction was done, which was aided by intact dentition and cranial features. Third, we have something called Lady of Cow from Peru, approximately around 400 CE. So her image was reconstructed using ctDNA and dental morphology, which was taken from her remains. They also analyzed the dental dietary patterns and the cultural patterns, which was also found in the burial place. Next, it is also used to make forensic cold cases. Firstly, we have this 10th girl, she was Barbara Ann Hackman, who was actually killed. So unidentified remains with intact skull, and the partial dentition was used to locate her, and the reconstruction was done using the dental midline symmetry. It yielded a positive identification via the missing persons report. And then secondly, we have Cleveland torso murderer. So there were so many victims who were in the USA who were there in USA in 1930s. So dental records were the key in confirming the identity of several dismembered victims. So it played a very crucial role where ante-mortem photos were absent. Third, we have this Eid girl in Netherlands, this fossil was from the 1st century BCE. So her warped body was preserved with soft tissues and mandible. So facial approximation combined with dentition analysis was used to estimate the age and sex of this individual during the 1st century BCE. Next, facial reconstruction of King Richard III in UK was done in 2012. So it was seen in Leicester in UK. So a complete 3D CFR was done using CT scans, digital odontometric data was there, and it matched the portraits which were there in the British palace from the Tudor era. So it showed the precision of the imaging system. Thirdly, we have facial reanimation and museums, mummy case studies. So we have Ramesses II, so they reconstructed the profile of us, and Tata and Kahaman, where they revealed that cleft palate, overbite, and genetic disorders were possibly there. And there is this KV35 young lady where she's suspected to be a queen. And it was reconstructed using mitochondrial DNA, and it helped to map the Amarna loyal lineage. So technologies in innovations in model CFR. So we have various imaging and modeling systems, AI integrated with machine learning, and we have hybrid reconstructions and outreach and education programs where digital training models are now a part of dental forensic curriculum. So recent advances are we have AI personalized facial modeling, 4D facial aging simulation, predictive analytics from dental tissues, multimodal biometric fusion, which uses cross-referencing odontograms, genetic markers, isotopic ratios, and facial musculature data. It increases the confidence in reconstruction from the fragmented remains. We have augmented reality applications, which is for recent days, where it simulates the reconstructed faces overlaid on skull in real time. So it is used for museum storytelling, forensic education, and public archaeology. So to conclude, every face reconstructed is a story retold, bridging the past and the present through the precision of science and the lens of humanity. Thank you.